Acknowledgements to His Excellency the President of the Republic of Fiji, Ratu Health Dr for his most gracious and inspiring address a few days ago. Mr. Speaker, sir, allow me to begin by warmly congratulating you on your appointment to the seat of the Speaker of the Republic of Fiji and Honorable Lenora Tambua on her appointment to the seat of the Deputy Speaker of this august House. We pray that the Lord will bless you both and give you wisdom and strength for these important roles for Parliament and for Fiji. His Excellency reminded us of how we have forged ahead as a resilient nation with committed efforts to address the global pandemic, natural disasters, and a period of uncertainty, distress, and loss that gripped our nation. His Excellency also called on his august House to embody the collective spirit of resilience and resolve of our people, bringing the hope of a promising future for the citizens of our beloved nations, which we all call home. And this must be facilitated through a clear focus on the rule of law and democratic processes, including transparency, accountability, respect of human rights and freedoms, and listening to the views of the people through genuine consultation. His Excellency has also pointed to the Herculean economic challenge before us, inherited by the People's Coalition Government, which we must now work together with to deliver government services to the people of Fiji. With a restrictive national debt, we must nonetheless forge ahead cautiously and thoughtfully to meet the expectation of our people and services we expected to deliver. Mr. Speaker, sir, as Minister responsible for health and medical services, I salute all 7,000 health workers serving around Fiji and thank them for their commitment and efforts in seeing our nation through one of its most turbulent times, fighting the COVID-19 pandemic in the last 3 years and keeping it at bay, which we are still continuing to do today. We acknowledge all our development partners, health partners, and donors who stood by us and supported our effort in dealing with the outbreak in Fiji. We also acknowledge our NGOs and various organizations such as Friends, the Fiji Nursing Association, Friends of Tavarua Group, families and social community groups, and individuals who we did not hear about, yet whose efforts were critical to the overall success of our response. Mr. Speaker, sir, on the health sector, His Excellency the President revealed that the People's Coalition Government is drafting plans for the revival of health and medical services in our hospitals by improving and maintaining facilities, services, skills training, and patient care. In my first 3 weeks as Minister, we have managed to visit over 50 healthcare facilities so far in the northern, western, and south divisions, and converse with many hundreds of healthcare workers across Fiji. This has informed my view that there are two key elements essential to our vision for excellence in healthcare, and these are: one, a dramatically improved and maintained health infrastructure, from the divisional hospital, such as CWM Hospital, and all the way to the most remote nursing station. Secondly, a well-supported, appropriately remunerated and capable healthcare professionals. You can have the best health infrastructure. However, without the capable, caring and professional staff, we will not have a healthcare system. From nurses to doctors, to cleaners, to community health workers, all need to feel appreciated and be adequately supported. These are big issues to address, and we will take time, but we will embrace the challenge. Mr. Speaker, in my previous contributions in this august House as an opposition member, I highlighted the opposition's concern on the reductions in budgetary allocations for infrastructural works for the health ministry. Our recent visits have confirmed that we feared would be the outcome. Except for a few healthcare facilities that are in good shape, the majority are in a poor state with damaged infrastructure, an insufficient program for maintenance and upkeep, and with poor water, hygiene, and sanitation facilities. The Ministry of Health and Medical Services will prioritize improving and maintaining our 220 health facilities and associated infrastructures. In doing so, we can improve the environment in which healthcare is delivered to our people and also improve the working environment for our valued medical staff who are sent to these facilities to live, work, and serve the people of Fiji. We will place greater emphasis on these facilities with better access to water, sanitation, and hygiene and power, and internet connectivity wherever possible in a sustainable and environmentally friendly manner. Mr. Speaker, sir, the ministry has come under spotlight lately, has been scrutinized by the media and members of the public on social media. The focus is on the state of some of our hospitals and medical infrastructure around the country. And I agree with them, Mr. Speaker, sir, because after visiting the medical facilities around the country, the majority of the infrastructure is in need of repair, renovation, or a total makeover. There have been significant neglect for the past 16 years. As many will now be aware, the Honourable Prime Minister has instigated improved freedom of the media. One element of this was to facilitate a media visit to CWMH last week. This is a crucial step in showcasing the challenges we face now, and now the Ministry, with the support of bilateral and multilateral development partners, civil society, private sectors, communities, and like-minded individuals all have an important role to work in partnership to deliver improved